Good morning. Yeah, we're recording. Good morning, everyone. It's good to be back. This is our Tuesday talk again, the HER, Health Empowerment Reset. We're excited for today's topic like we are every week, but today we have a very special guest today. We have a doctor, and she's also an integrative medicine physician. So we're going to talk about a very, very important topic that some people don't know much about it. Sometimes maybe some confusion, confused about the topic. So we're excited about it. So we're just going to introduce ourselves first. So my name is Martha King, and I'm an integrated certified health coach here in Hanover, Pennsylvania.
Hi, I'm Julie Lynn Duarte, Dr. Duarte. I own Core Vitality, and I have a small practice here in Hanover, Pennsylvania, but I also can do telehealth services as well. And my specialty is gut health.
Asha?
My name's Asha Scatchard. I'm a Brennan Healing Science practitioner, which is a form of energy work. My practice is in York, Pennsylvania, and my website is energybodyworks.com.
Dr. Nair.
Hello, everyone. I first want to thank you, Martha, for inviting me to speak on this topic today. So I appreciate you inviting. I am Dr. Nair, and I have my own clinic in Gettysburg. It's our Integrative Medicine Clinic. I'm a board-certified family physician, and I did a fellowship in integrative medicine through Dr. Andrew Weil's program. And I've also done like many functional medicine modules through Institute of Functional Medicine. I primarily do consults. I don't function as a primary care physician now. And, because of insurance companies and everything, it's just difficult. So it's a cash-based model. And I'm just a solo practitioner.
We're so honored to have you on this panel. On this, so when we talk about the thyroid, some of the things that you're going to cover, the first thing I could think of is being a thermostat. Just like in a home, you set the thermostat at a temperature, and you're hoping that just pretty much stays within the temperature against all the elements, the forces out there from the outside, from the inside. So the same things with the thyroid. It regulates the temperature in our system, and it has a lot of functions with the hormones. So we're going to learn about what the root causes of all the issues that people have, and pretty much overall about thyroid health. So you have the floor.
Thank you. So as you know, the thyroid gland is situated right here, like where your Adam's apple is? It's located right there. It's a butterfly shaped, like a tiny gland. It's an endocrine gland, and what it does is it actually is involved in many functions throughout the body. So people think, oh, thyroid means just one function or not. Like you mentioned, thermoregulation is definitely one of that, but it does a lot of other functions too. So it's interconnected with your whole body system. And that is why when we address like thyroid condition, it's important to address like many different systems in your body. Like you want to look at your gut health, which I'm glad you're on here, Julie. And, we want to look at what else could be affecting. Like it can affect your bone metabolism. It can affect your insulin sensitivity. Your blood glucose levels in your body can be controlled because of your thyroid. It can also, there's just a multitude of functions that your thyroid is involved in. So when we have a problem with your thyroid gland, it presents as different symptoms from head to toe. So some of the symptoms people have, like, okay, you can have an underactive thyroid or an overactive thyroid, right? Usually people are very familiar with hypo, which is underactive, and hyperthyroidism, which is overactive. And then we have autoimmune thyroiditis. So autoimmunity is responsible for 90% of thyroid disease in the United States. So that is key to address when you're addressing a thyroid condition, which I think we fail to do in the traditional medicine setting.
Mhm.
So what happens in the traditional setting is we order multiphasic labs and we only order thyroid stimulating hormone levels. We don't do the full panel. And it can come back as normal, but you may still be having constipation, dry skin, weight gain, depression, all these symptoms. And your thyroid, your doctor will just tell you, oh, but your thyroid level is normal. It's not your thyroid. And what I have seen in the last 2 years is I do the full panel, which includes your thyroid stimulating hormone, your free thyroid, like your free T3, T4, your antibody levels, which is your thyroid peroxidase antibody, thyroid binding globulin, all of those. And those levels could be elevated, but your TSH could still be normal. And so it's so key to do the right lab to diagnose a thyroid condition. And so when we look at the labs, a little bit about the labs. So TSH is one key thing, key lab that we look at, okay? So if that number is elevated, it's high, then we look at your free T3 and free T4. If your free T4 is low and your TSH is high, that's a sign of underactive hypothyroidism. Now, if your TSH is low and your free T4 is high, that's hyperthyroidism. So some people get really confused. They think if the TSH is high, it's hyper. It's not. If your TSH is high, it's actually underactive. That's because your pituitary gland, which is another master gland in your body, secretes thyroglobulin releasing hormone. Now that goes and acts on your thyroid gland and makes it secrete the thyroid stimulating hormone. And that's your TSH. So if your body has low free hormones, then you have the loop telling your brain to, hey, we need more of this to be produced. So then your TSH production increases, okay? And that's a sign of underactive thyroid. Have I made it clear or more confusing?
Oh, so good.
Okay, so looking at the antibodies. Now, in autoimmune thyroiditis, we have two different kinds, Hashimoto's or Graves' disease. And Hashimoto's is underactive, hypothyroidism. Graves' disease is more hyper. How to differentiate the two is we do 3 antibody testing. So your thyroid peroxidase antibody and your thyroglobulin antibody, if they are elevated, but your thyroid stimulating immunoglobulin is normal, then it's Hashimoto's. If your thyroid stimulating immunoglobulin is elevated, it's Graves'. That's the difference between the two. The autoimmune thyroiditis, your TSH levels can go up and down, and fluctuate. That is a sign, like, so say somebody goes for their multiphasic and the only lab they're testing is TSH. You do it now and it's, say, normal. Next 2 months, you do it like in 3 months and it's elevated, but still within the normal range. And then you do it 3 months later and it goes down to lower end of normal. That's a fluctuation. It's not stable, right? And that's an indication that you should test for autoimmune disease. Maybe that's a root cause of it. So addressing that is key. Now, what are some of the triggers for thyroid disease? Some may ask, okay, when you say root cause, what are you talking about? Okay, one can be diet. So gluten is a major trigger for autoimmune disease. Why? Because the gliadin protein in gluten can cause like a leaky gut. So your gut has like tight junctions, the wall, And this gluten, when it's exposed to it constantly, sometimes it can cause those tight junctions to leak. And the gluten then enters your bloodstream. And then your body sees it as a foreign body and creates an immune response. Okay? And some of that gliadin protein is similar in structure to your thyroid tissue. So your body starts attacking your own thyroid tissue in the process. And that's how you end up with an autoimmune thyroid disease. So gluten is major. Even people might say, but I'm not celiac, I got tested. So there's two different things. There's celiac disease where you do the HLA-DQ genes and you confirm it with some biopsy or even like with other labs. So if you're celiac, then of course you have to eliminate gluten completely. But there's another entity called non-celiac gluten sensitivity, where you're not celiac disease, but you have sensitivity to the gluten protein. And that's a difference that people need to figure out. Other triggers, one main thing is iodine. I'm pretty sure many people have heard iodine deficiency is causing a thyroid disease. So you have to take iodized salt or you have to eat seaweed, And what we've come to find out with research is iodine, thyroid gland already has an iodine trap inside it. So there's enough iodine inside your thyroid gland to convert for the thyroid peroxidase antibody to use, because it's a cofactor for that enzyme, to convert your levels to T3 and T4. And so when we give extra iodine, it sometimes triggers an autoimmune response and causes more problems. So that's one thing we need to remember, okay? Then there are environmental toxins. Your toxins enter your body through all, you can inhale it, apply topically. As women, we put a lot of cosmetics and personal care products, and our body can absorb that in 26 seconds. Like your skin can absorb toxins in 26 seconds. And so some of those are xenobiotics, and they cause an estrogen problem. So they can increase the estrogen production in your body, and that can affect your thyroid immensely. So when there is that imbalance in your hormones, your thyroid, there's an interconnection between your sex hormones and your thyroid gland. So that's another trigger. And then your gut. Your gut is very important in the production of thyroid glands. So for example, your thyroid gland secretes T3 and T4. Now T3 is the active form of thyroid. It's not T4, okay? And your thyroid secretes the T4 in larger amounts than the T3. So where is all this T4 being converted to T3, the active form? Some 60% happens in your liver. And then the remaining, the 20% actually occurs in your gut. So if you don't have a healthy gut flora, your T4 doesn't get converted to the active T3. So then you become hypothyroid because you're not having enough T3 in your body to do the functions. So gut flora is very important for thyroid health. What else can I talk about? I'm just trying to think. So far, do you have any questions?
No, I'm just sitting here thinking, I know a lot of people that have Graves' disease and other different types of thyroid conditions. And, with the purpose of our talks is just pretty much balancing all the pillars. You talk about stress, that major impact as well on thyroid, lack of sleep. That's also, so I just want to bring those two up again. So stress, lack of sleep, movement, the exercise, not moving, it also impacts your thyroid.
Yes. So stress is very important, like you mentioned, because when we are on a chronic state of fight or flight, The chronic state causes your cortisol levels to be way off. And cortisol causes inflammation in your body. Okay? And that's a root cause of many diseases. It can cause a leaky gut, which we just talked about how it produces autoimmune disease. And so controlling stress reduction is very important. So when I address anybody with any condition, I look at all those pillars like you talked about, looking at the nutrition, looking at the stress level, trying to teach them some mindfulness, self-care techniques that they can practice. Addressing sleep. Many people think, oh, I can sleep, or, oh, yeah, I think I sleep 8 hours. But the key question is, how rested do you feel when you wake up? You may be sleeping 8 hours. Are you feeling rested? Or are you having like that mid-afternoon crash at 3 o'clock? Those are signs of adrenal fatigue or adrenals being affected. And as you know, adrenal glands like the epinephrine and the norepinephrine, they play a role in the thyroid health. So that's where the whole adrenals, pituitary, the thyroid, they're all interconnected. So, it's key to address all the systems and not just focus one thing. Relationships, that's a major, right? Like addressing that is important, because if you are always on the go and no self-care, and what's your relationship with your loved ones? Are you depressed? Those can all play a role too. So I think addressing those pillars is very, very important. And as a health coach, I'm sure those areas are your key focus in addressing the whole person. Yeah.
Oh, yeah. Yeah. Julie Lynn, do you have anything you want to?
I think you brought up some excellent points. I think you make a very good point about the labs. We talk all the time about lab values and what's normal and what's not. But at the end of the day, as you pointed out, you can have normal labs, not mean that there's not something more functional that's not, right with the lab. So we always say normal doesn't mean optimal. And there's always other labs that you can do to see if really that normal value means optimal for that particular person. And so I appreciate you bringing that up, because I have that conversation often when people come to me and say, here's my labs and they're normal. You got to do a little bit more digging to find out normal may not mean optimal for that person. Also, I appreciate you bringing up the leaky gut and the correlation, because that's my jam.
Yes.
Leaky gut is, we know the key to developing autoimmune disease. Autoimmune diseases start in the gut. Leaky gut's the number one reason for that. So I do appreciate you bringing that up. That is that we definitely work on, making sure somebody does not have leaky gut, and if they do, fixing it, because oftentimes then we can help minimize symptoms or get rid of them altogether and actually correct whatever autoimmune disease they have, or at least get them back to some vitality and living life with optimal health. So I thought the talk was great. I really appreciate you presenting this information. It was really informative. So thank you.
Thank you.
Asha, do you have?
I do. I have a question, because my forte is energy work. And how does functional medicine feel about energy work, balanced chakras, which really are very key to the health of the body? So where is functional medicine in relationship to energy work? Are they accepting, or is it still a no? Where are you at?
So me personally, I'm very open to energy healing. And I cannot speak for other functional medicine doctors in regards to that, because you know, it's like talking about Ayurveda, traditional Chinese medicine. These are all individual modality, healing modalities, and they have their own way of healing, right? So energy healing is one, like Reiki, there's even spiritual healing. All these are different modalities of healing. And from an integrative medicine physician standpoint, I try to integrate all these modalities into the treatment process. So I try to use and tell my patients, okay, I know a great acupuncturist. I think you would benefit from that. I know somebody who does spiritual healing or energy healing. I think you should go see this person. So I try to combine those modalities and not just do functional medicine. Now, functional medicine is more like, you know, it's a little different than integrative medicine, because in functional medicine, we kind of do the biochemistry part of it and trying to look at labs a little differently, trying to dig and get to the root cause. So if you ask me, do all functional medicine providers accept energy healing? It varies. I don't know the answer to that. But do I? Yes. I fully embrace all these modalities and try to see what's best for the patient and try to get them to the right person. Does that answer your question?
Yes, I think that's a great answer. Many of the clients that I have, I'm sort of a last resort. They've tried everything and then they come to see me. But I'm glad to, I'm always curious about the perspective, because many years ago, nobody even heard of energy work. But now it's more of a, it's more in the forefront. So thanks.
Yeah. And I think, like, you know, we talked a little bit about how the emotional piece that many doctors tend to miss. Like, we try to focus on the lab results and on the symptoms and not as the person. Like, I have had so many patients, like mostly women, who come and see me, and I try to dig deeper and deeper, and there's some root cause emotional trauma that they have had or experienced, which contribute to their disease process. I believe in that. And to address that, sometimes they need that energy healing and spiritual healing, I think is important. Like, I have been, you know, I do some Reiki on some patients, but I ask permission first. Mm-hmm. But if I feel like they have more, I always say I'll pray for them. That's one thing I always do. But I will refer them to somebody who's more specialized in energy healing and who's, you know, who can do a better job than me to address that. Mm-hmm. So yeah, I'm very open to that.
Well, that's great to hear. Thank you.
I like when you said the integrative approach, because versus the functional medicine, and I understand both fields, but bringing the conventional medicine, bringing that integrated approach is just more adding more things to the ROM and giving people more choices, that there is more to this, that there is more to whatever, you know, there's different modalities, different tastes out there. So that's what we're doing these talks to, giving people, which I want to emphasize something that I should have said at the very beginning, and I want to emphasize it right now, that please know out there that these talks are just for educational purpose only. It's not about recommending one thing or the other, or giving medical treatment or diagnosing. So I just want to emphasize that, and I meant to say that at the very beginning. So there you have it. So any other questions? I know we're running out of time here, and any other?
No. Okay. So if anything, I just appreciate you having me on here today.
Oh, we're just honored, and this is not going to be the last time, though. I hope you're okay with that. And I'm sure you have many things to talk about that, you know, I came to many of your talks in the past, and you know, I just walk away with so much, and you know, you just very knowledgeable and just your energy is just amazing. So I always appreciate your work. So
I have a question.
yes.
Where is your practice?
So currently I'm doing virtual visits.
Okay.
So I do have a small space in Gettysburg. It's right across from the Majestic. It's at 18 Carlisle Street in Gettysburg. But I have been doing virtual consults over the past 2 months.
Okay. And your phone contact?
It's 717-420-2637.
Do you have an email address you want to provide as well?
Sure. It's Dr. Nair, DRNAIR, at Aura Medicine, AURA medicine.org.
Okay. Wow. So,
Awesome.
yes, this was great. So thank you all of you again for attending, and thank you all, everyone out there for your time, and we'll see you next week. Thank you.
Thank you.
Bye.
Bye.
Bye.